Revision amputation surgery. Revision amputation of a finger means that the structures that are being amputated must be taken away, and the structures that remain must be put back into a position where they don't cause problems for the patient. This means the tendons, nerves, and arteries must be put into a better position, and the germinal matrix, or the part that creates a nail, must be removed entirely. If the germinal matrix happens to not be removed entirely, meaning that even one cell starts forming nail again, the patient will need further surgery for removal of the ectopic nail and remaining germinal matrix. A patient will then get back to their normal routine with hand therapy, and sutures will be removed over the next few weeks after surgery.